You're listening to SDO Isabela Radio-Based Instruction.
Come on, Mape!
Yay!
Mape paawit, Mape pagguhit, Mape sayaw at Mape lusog ka. When learning continues in Mape Edukalidad. Hey!
When learning continues in MAPE Edukalidad.
Hello, my dear grade 10 learners! I am so happy to be with you today. Welcome to our first episode in Health 10. I hope you feel excited as we continue our lessons amidst pandemic. By the way, I am Rhea Jane Valle Bernardo, your teacher on air. Before we start our topic, kindly prepare your MAPE notebook and pen for you to take note of the following details in our health subject. Also, find a comfortable place for you to listen and learn for today's episode. Are you now ready? Good. This is our first episode in MAPE Edukalidad for the third quarter. Our discussion today will focus on the significance of global health initiatives. Before we proceed to our new lesson, may we first answer the diagnostic test. This is the direction. True or false? Write true if the statement gives us correct information and false if the statement gives us false information. Number 1. The term global health rose in popularity along with the rise of globalization. Number 2. Global health pertains to various health issues, concerns, and trends which go beyond national boundaries. Number 3. Global health is a call for global initiatives for the protection and promotion of people's health across the world. Number 4. Global health initiatives are programs and projects which help address global health issues, concerns, and trends. Number 5. World Health Organization is the primarily international body responsible for developing leadership in health, setting norms and standards, and providing health support among nations around the world. I will give you a minute to answer these questions. Timer starts now.
As I play the Radyo Eskwela song.
Pagkat kayo'y kinabukasan, ang pag-asa ng ating bayan, isa pusong pagkatuto ng matupad ang pangarap mo. Pagkat sa gitna ng pandemya, tayo pa rin ay magkaisa upang masigurong bawat bata ay bumabasa. Halina't matuto gamit ang ating radyo, pakinggan at unawain, aralin na ituturo. Patuloy ang edukasyon para sa ating henerasyon. Sa daan ng pagkatuto ay walang maiiwan. Kaya halina sa Radyo Eskwela.
Time is up. Now, let's see who got the correct answers. Number 1 is true. Number 2 is true. Number 3 is true. Number 4 is true. And number 5 is true. Who got perfect score? Wow, impressive! let's explore about our topic. So come on. Global health is the most crucial issue that is being addressed immediately. Countries which under such as issues are put into state of crisis. The term global health rose in popularity along with the rise of globalization. Both terms improve public awareness of vulnerabilities and shared responsibilities among people for the different injustices in the world. Global health, coined by Ilona Kickbush, pertains to various health issues, concerns, and trends which go beyond national boundaries and call for global initiatives for the protection and promotion of people's health across the world. What does it mean? Correct. When we speak globally, we are referring to national boundaries, specifically with health issues. My dear learners, since we are talking about global health issues, what particular issues we are facing right now? Unluckily, we are facing the global pandemic that greatly affects every individual in any part of the world, which is the SARS-CoV. A health issue which addressed immediately and acted immediately by the United Nations and World Health Organization to protect the health of individuals across boundaries. The primary international body responsible for developing leadership in health, setting norms and standards, and providing health support among nations around the world is the World Health Organization. In the Philippines, what group that was put up which is responsible for the developing leadership in health, setting norms and standards, and providing health standards during this pandemic? Brilliant! The COVID-19 IATF, or the Interagency Task Force, who serves standards in health protocols such as wearing a face shield and face mask, following social distancing, and the likes. Global health initiatives are programs and projects which help address global health issues, concerns, and trends. Examples are Stop Tuberculosis or TB, Roll Back Malaria, Global Fund to Fight HIV or AIDS, Malaria and Other Diseases, Framework Convention on Tobacco Control, Comprehensive Mental Health Action Plan, Global Strategy to Reduce the Harmful Use of Alcohol Global Strategy for the Prevention and Control of Non-Communicable Diseases. Quick Wins is a UNDP intervention program which refers to the actions that can be immediately used within the community or local to produce effective results. Again, class, what do we mean by UNDP? Exactly, United Nations Development Program. UNDP also set goals for its member nations to be fulfilled on a agreed span of time. In 2015, to be evaluated and counter-checked under the world standards. UN, or the United Nations, created MDG, or the Millennium Development Goals in 2000 in effort to improve life in developing regions by 2015. And there are 8 Millennium Developmental Goals, which are solemn pledge made by all countries in the world. They are distilled from the Millennium Declaration. They are people-centered, measurable, and time-bound commitments to address the challenges facing humanity in the 21st century. In September 2000, the UN General Assembly gathered in New York for the Millennium Summit. At that meeting, 189 heads of the state of government pledged to work together, acknowledging their duty to all of the world's people. The Millennium Declaration is the landmark document resulting from this meeting. The MDG were born from this Millennium Declaration. The first one is to eradicate extreme poverty and hunger. Developing countries, particularly in Africa and Asia, suffer from extreme poverty and hunger. Poverty and hunger leads to severe malnutrition, which leads to lifelong physical and cognitive damage and affects health, well-being, and the economy. Some key suggestions to eradicate poverty and hunger are education, promoting gender equality, producing more jobs, investing more in agriculture, and strengthen nutrition programs for children and infants. The second one is to achieve universal primary education. Persons, particularly women who are educated, are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adopting healthy sanitary practices, and ensuring immunization of children. As an effect, infants and children have better survival rates, which are healthier and better nourished. If these are attained, children who receive primary education are more likely to marry and have their own families at a later stage in life. Practice family planning and have fewer children, responsibilities, and civic obligations. Seek employment and sustain personal and family needs. Have decreased risk of getting sexually transmitted infections like HIV or AIDS, and support and protection of developing and vulnerable countries during crisis. The third one is promote gender equality and empower women. It is the gender equality means equal representation of men and women. It implies that all genders should have equal value and treatment. Equal gender treatment empowers women and other groups, creating opportunities in education, work, finances, and other aspects, which improves the economy and lessen effects of financial crisis. Gender equality can be achieved through early childhood development intervention, promotion of women's political rights and involvement, improve reproductive health programs and policies, education and integrating gender equality in school curriculum, and improve women's access to work and strengthen labor policies for women. The next one is reduce child mortality. These programs and policies which help reduce child mortality, like improving nutritional intake, healthcare facilities, and infrastructure and other fields which improve children's lives. Strengthening local and national health programs and policies is one way to reduce child mortality. This includes immunization programs, assuring the survival and better health of mothers, improving reproductive health programs and policies, and better nutrition program for infants, children, and mothers. The other MDG is to improve maternal health. It is not only about mother's health, but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender inequality, decreased workforce, lower birth deaths, and disability of women. Some ways to improve maternal health include improved and proper nutrition of mothers, teaching the benefits of child birth spacing and small family size, educating young boys and girls about the importance of maternal health, and better and improved access to hospital care, especially obstetric gynecology, prenatal, and postnatal care. The sixth one is to combat HIV or AIDS, malaria, and other diseases. Emerging and re-emerging diseases like HIV or AIDS, malaria, influenza, and other diseases affect productivity and growth of nations. Some of the effects of disease outbreak are loss of jobs, shortage in professional workers, and creating social crises. Children are the most vulnerable and are exposed to exploitation and abuse, undermining their normal growth and development. Some ways to combat diseases include effective prevention, treatment and care like improved housing conditions, increased access to anti-malarial medicines, promoting safer sex behavior and preventive education for all, promoting tuberculosis screening of HIV/AIDS persons, and TB directly observed treatment short or TB dots, course therapy, and promoting the use of insecticide-treated nets to fight mosquito-borne diseases. The seventh one is to ensure environmental sustainability. Investing and supporting sustainable energy like solar, wind, and water energy help support jobs, create businesses opportunities, and save remaining non-renewable energy sources. Environmental sustainability assures people to live healthier and enjoy a clean and green environment. Some of the benefits of a sustainable environment are cleaner air and environment, clean environment friendly and renewable energy, new and aspiring jobs and business in energy, and increased access to sanitation. The last one is the Global Partnership for Development. It is the United Nations World Health Organization, World Bank, and governments work together to make sure there is fair trade and that heavily indebted countries obtain relief and funds to combat poverty, malnutrition, and funds for education and social projects. Some benefits of global partnership are expanded international trade agreements, improved access to affordable medicine, reduce poverty through government debt relief grant, and develop information and communication technology or ICT. There are 195 countries in the world today. This total comprises 193 countries that are member states of the United Nations and 2 countries that are non-member observer states, the Holy See and the State of Palestine. These countries are also adopting the MDG so that globally we can assess and implement programs that are inclined with global health trends. Specifically, we are facing the worldwide dangerous virus, the SARS-CoV. To wrap up the lesson for today, let's answer this question. Class, are Millennium Developmental Goals achievable in this time of pandemic? Exactly. According to Professor Jeffrey D. Sachs, a special advisor to the Secretary General on the Millennium Development Goals and director of the UN Millennium Project, the MDGs are achievable. Yes. Prefacing his report Investing in Development, he states that the world community has at its disposal the proven technologies, policies, financial resources, and most importantly, the human courage and compassion to make it happen. Hence, in this time of pandemic, we can continue improving the lives of each individual as long as we have the human courage and compassion to make it happen. The United Nations and World Health Organizations sets this MDG or Millennium Development Goals for us to have the quality of life we are wanting right now. Is global health can be attained by combining population-based health promotion and disease prevention measures with individual-level clinical care? Correct. Global health with the help of World Health Organization and the law-abiding citizens whose only goal is to have a healthy lifestyle could be attained. And I think you are now ready for the short quiz. This or the instruction. Choose the letter of the correct answer. Write the letter of the correct answer in your Health 10 notebook. Ready? Number 1. Health issues that transcend national boundaries and governments and therefore require collaborative research among nations for their cure are called A. Wellness issues, B. Sickness prevention issues, C. Global health issues, or D. Illness concerns. Number 2. Which of the following is not a factor for the increased risk of global health concerns spreading? A. Decreasing population, B. Ethnic conflicts, C. Poor economies, Z. Inadequate health care. Number 3. Which of the following is not a common symptom of the COVID-19? A. Shortness of breath, B. Dry cough, C. Pneumonia, D. Diarrhea. 4. Patient X got infected with coronavirus prior to the onset of symptoms. He transmitted the disease to patient Y and patient Z. Patient Y received supportive care and tested negative for the virus afterward. Patient Z had symptoms almost absent but is still testing positive for the virus. Which of the following is not correct regarding patients X, Y, and Z? A. Patient X, healthy carrier. Patient Y, active carrier. Patient A, convalescent carrier. B. Patient X, incubatory carrier. Patient Y, active carrier. Patient Z, convalescent carrier. C. Patient X, passive carrier. Patient Y, active carrier. Patient Z, convalescent carrier. D. Patients X, Y, and Z are active carriers. Number 5. Which of the following infectious diseases is considered the leading cause of death globally? A. AIDS. B. Tuberculosis. C. Cholera. D. Ebola. Now, grade 10, let's check with your elders with you at home. Remember, honesty is the best policy. The answers are the following. Number 1, C. Global health issues. Number 2 is C. Poor economies. Number 3 is C. Pneumonia. Number 4 is
Letter C.
Patient X incubatory carrier, Patient Y active carrier, and Patient Z convalescent carrier. And number 5 is letter B, tuberculosis. Who got perfect score? Wow, impressive! Let's give yourself a round of applause. I really appreciate your time and effort in bringing the best of your performance today. Make sure that your parents or guardian will be the one to submit your quiz form following the safety protocols. Understood? You just listened to our fruitful lesson in Health 10. On behalf of the RBI production team, I am Rhea Jane Valle Bernardo, your radio teacher, reminding you all na sa panahon ng pandemya, walang batang maiiwan sa SDO Isabela. Stay home and stay safe. Goodbye and enjoy the rest of the day.
Patuloy ang edukasyon para sa ating henerasyon.
Sa daan ng pagkatuto ay walang may iwan.
Kaya halina sa Radyo Eskwela!